Thank you, President Davis, for granting me my Lincoln Center debut. And best of all, none of you have to listen to me sing or play the clarinet. I promised President Davis I would be short, but of course short is relative. And I want to remind you I am an Emanuel with a microphone. So I want to begin thinking about three things you're not going to remember after today. One, you're quickly going to forget who gave your graduation speech. I graduated medical school exactly 30 years ago. Well, to be honest, I didn't actually graduate 30 years ago. I was supposed to. They kept me behind for 3 years. I needed a few more letters after my name. It wasn't long enough. But I can't remember who gave my graduation speech, either the one I was supposed to be in or the one I actually attended. And you won't remember either. Two, you're not going to remember not only who, but what I say. You won't remember what I say here because it's virtually impossible to do anything memorable at these graduation events. There have been hundreds of thousands of speeches at these events. They're all supposed to be profound and memorable, and they almost all turn out to be banal and forgettable. It's the nature of the event. I suspect you can't recall what was spoken about at your college graduation. I certainly can't remember what was spoken about at any of my graduations either. Third, and most importantly, you won't remember most of what you learned in the first 2 years of medical school, and it won't make any difference. Except for anatomy and a few other tidbits, most of what you learned in the preclinical parts of medical school, how do I put this delicately? Not very relevant to taking care of patients, and you'll not need to know them. The Krebs cycle, Starling's law, that stuff about pharmacokinetics, the special characteristics of lentiviruses, what kind of diseases they cause, how you combat them, not particularly relevant to patient care. And much of it's going to be outdated by the time you finish your residencies anyway. Maybe that's why most of you, I suspect, did not go to class, but watched the video at double and triple speed. I'd say that decision was pretty wise. Now that we're clear about what you won't remember, and won't be the worse off for not remembering it, and why, of course, I'll never be invited back to Mount Sinai School of Medicine, going to be nicely airbrushed out of the graduation pictures, I want to talk to you about the one big thing that you will promise me you will never, ever forget. No matter how stressed you become, no matter how overwhelmed you are as an intern or resident. Ask yourself why you chose to become a doctor. I'm sure each of you has a personal story, as do I. But I'm also sure that there's overlapping reasons that we all share. And one of the most important parts of that overlapping reason is that you became a doctor not for money. You will do well. You will do very well. After all, you're becoming a doctor. Between you and a working spouse, you'll certainly enter the 1% of American society. That's true even if you dedicate yourself to caring for the poor, working in primary care. You and your spouse are very likely to earn more than $376,000 per year, and that's what gets you into the 1% in America. Never forget that privilege, and never forget that responsibility. But you also made a very explicit decision not to chase the money, not to make money the object of your life. You're all very smart. After all, you got into Mount Sinai. You're here graduating today. You literally could have done anything. When you came to Manhattan, you decided to come uptown and not go downtown. You decided to do medicine and not go to Wall Street. And that's key to the kinds of people you are. You decided to choose a path that nearly guarantees a meaningful life of contributing to others, even if you ended up choosing radiology or urology as your specialty. You decided to choose a meaningful life of contribution and not just making millions or billions. If that's the negative reason you went into medicine, what's the positive reason you slogged through organic and physics and calculus, then all those medical school applications, all those interviews, anatomy, pathophysiology, microbiology, those sleepless nights in the ICU, the ER, the obstetrics ward? Maybe after I recited that list, you're trying to wonder whether you did the right thing. But deep down, the reason you did this is you want to help people who are in distress, in the most profound distress. You wanted to help people improve their health and their well-being. Now, I know it's just about this point. You're saying, blah, blah, blah. Help others. Yep, another banal and forgettable speech. Time to talk to your neighbor. Maybe, but I don't think I was asked here because I'm the typical banal and forgettable type. Maybe forgetful, but not forgettable. So let me just say, taken seriously in the 21st century, truly being dedicated to your patient's well-being is going to challenge you a whole lot more than having a good bedside manner, providing evidence-based medicine, and knowing how to handle the challenges that Dean Charney just discussed. All of that is necessary. It's the groundwork, it's the foundation, but it's not enough going forward. Sometime when you help people in distress, it's certainly minor distress, a cut needing sutures, a fracture needing a replacement. Sometimes it's a life and death situation. When I decided to go into oncology, it was because it combined everything that was meaningful for me. Intense relationships with patients and their families, helping them while they face the ultimate threat, their deepest value choices. The cutting-edge science, trying to solve the mysteries of cancer. Helping people as well as society cut through the pressing ethical challenges of informed consent, experimental treatments, end-of-life care, and then the biggest challenge of how to allocate all those expensive resources and how to make sure we did it responsibly. And I'm quite confident each of you, in your soul, has a reason similar to that, helping patients. Just spend a moment thinking about it. Another formal way of putting this that people in my field, bioethics, talk about is, you're a professional. You're dedicated to the simple ideal of helping someone else get their health and well-being. Every one of you knows this in your bones, right? It's what distinguishes you as being a doctor from other people pursuing other professions. The fancy word for it is professionalism. A lot of us gray hairs, or some of us with no hair, people who by dint of age and survival have become leaders and spokespeople of the medical profession, worry about your dedication to professionalism. They worry that it's slipping away. And there's a lot of hand-wringing about it. But I don't want to sit here and wring my hands about it. I want to focus on how professionalism is evolving and how you will be a professional in the 21st century. At one time, we understood professionalism in what I will call an individual way, a sort of Marcus Welby way. It's what I, as a doctor, did to promote the health and well-being of my patients. I think what we've realized is that truly promoting our patients' well-being is not an individual effort anymore. It's a team and communal effort. It's not about good apples and bad apples, but good systems and bad systems. Julia was a patient of mine. When I inherited her on my very first day of oncology fellowship in 1990, She had metastatic breast cancer, and she had had it for over 10 years. She'd been carrying around 10 pounds of tumor. Everything you did an x-ray of or a CAT scan of lit up. And over the years, she'd received every type of anti-breast cancer treatment invented. She survived them all, but just barely. She got treated early on with an early anti-hormonal therapy called aminoglutathione. You've never heard of it, because that was in the dark ages. Unfortunately, the treatment had knocked out her adrenals. She was dependent upon steroids. Fortunately, her tumor was slow growing. She was able to go about a very vibrant life with her husband. When Julia found out that I had 3 young daughters, she rushed out to buy them beautiful red flower dresses for Christmas. I didn't have the heart to tell her that we were Jewish. But that was the kind of loving person she was. She did those things all the time. And one Saturday, in late winter of my first year, she had trouble breathing, went to the emergency room, and was found to have an infiltrate in her lung and pneumonia. By 7:30 Monday morning, when I came to round on Julia, she was dead. Cancer didn't kill her. Bacteria didn't kill her. Lack of steroids killed her. From one of our nation's best hospitals, a fantastic intern, dedicated resident, superb nurse, conscientious attending, failed to provide her stress dose steroids, including 2 teams, the Saturday team and the Sunday team. And Julia ended up dying. I was dedicated to promoting her health and well-being, but I wasn't enough. Julia was being cared for by a vast team. And of course, if you think about Julia, she's not unique. We have our PCP, but we might end up in an emergency room across town or across the country because of an incident. My mother's care might be delivered at home, not by her physician, but by a home health worker, a visiting nurse, or maybe even sometime soon, actually a doctor who makes house calls. To really make our patients' well-being our primary obligation, it's no longer good enough to do our best, to be dedicated to taking care of their health and well-being when we see them in the office or in the hospital. That is so 20th century. Today, we know that outstanding outcomes, just like medical errors, are really about systems of care. And to really be a wonderful doctor, that wonderful doctor you decided to be when you applied to Mount Sinai and came here, you need to be dedicated to improving the system in which you practice. You spent the last 4 years focusing on honing your medical knowledge and practicing your clinical skills and instincts. That's all necessary. It's the groundwork, as I said, but it's not sufficient. Now you have to begin to dedicate yourself to working to improve the system and make it as good as you are. What does that mean in practice? What does it mean to make the system better? What do you have to do? I certainly don't have a comprehensive list, but it has at least 3 levels, I would suggest. Your first obligation is to remove the harm and errors that our system inflicts on people. Your mother or father does not want to be harmed when they go to the hospital or to the physician's office. No one signs up for the suffering of an avoidable complication. Figure out where we're doing wrong things and fix them. 4 months after being an oncology fellow, I was tired and exhausted of writing and rewriting chemotherapy orders. We just had a few chemotherapy drugs then, and they were given in the same cocktails for breast, colon, and lung, and that's who got treated. But I had to fill out order sheets over and over again for each patient. The experimental treatments, by the way, were on protocol, and therefore they were typed up. I told my attending one day, maybe we could create pre-printed chemotherapy orders. The fellow would just fill in the BSA, the body surface area, and the total dose. It would simplify things. He dismissed my idea. He had no interest. After all, he never wrote the chemotherapy orders. The fellows did. It wouldn't simplify his life. Then 2 years later, we happened to kill a journalist, Betsy Lehman, because of handwritten orders where we administered 10 times too much chemotherapy. I say we, because there were at least 5 people directly involved in that mistake, and really the whole system was involved in the mistake. And then, only after that case, only after the hospital almost ceased to exist, did we adopt electronic order entry. I'll never forgive myself or others for not having pushed harder on that change. But as all of you know, there are hundreds and thousands of those small errors that happen every day. So you need to push and to create a system open to changing and adopting changes that will remove all the harms and errors we know are in the system. The second is to make care guideline-driven and evidence-based where we have evidence. Again, no one wants to be an experiment when there exists a very effective, proven treatment. It's your responsibility to create a system that routinely collects evidence on quality, publicizes that data, and has a regular process for improving the quality deficiencies and gaps. It is not acceptable to tolerate poor quality care, and a system that delivers it. And third, figure out how to bring it to your patients. As has become ever more clear, just being able to provide care or services, to write that prescription or make that referral, does not mean patients will do the right thing. Patients don't take their medicines properly, at least 30, if not 50% of the time. Patients go to the ER instead of their PCP or an urgent care clinic. They don't change their diet to control their blood sugars or exercise when you tell them to. These are behavior changes, and behavior changes are the hardest changes we have in our life. How many of you are sticking to your New Year's resolutions 4.5 months after New Year's? I bet the odds are pretty close to 0 of us. So you'll have to be creative in helping your patients do the right thing. And it's not just about you, because you can't do it all. You have to be creative about creating a caring system that just doesn't order tests and give out prescriptions, but does a lot more to change how your patients behave. And you need to think outside the box, as Dean Charney said, in that regard. So to be a professional in the 21st century, you have to do more than dedicate yourself to putting your patients' well-being and health first and primary. You have to dedicate yourself to creating a system of care where you practice that is consistently rooting out errors and adverse events, measuring, publicizing, and improving the quality of care, and helping patients make the hard behavior changes that will improve their own health. So if there's one thing you remember today, not my name, not what I spoke about, not the first 2 years of medical school, please let it be these 2 questions. What does it take to create a system that cares for people as well as you do when you go out there? And how can you do your part, not just to care for the patients, but to create that system of care? Only if those questions are at the forefront of your mind every day that you practice can you be a 21st century medical professional and prove that Mount Sinai Medical School did the right thing when it conferred upon you the MD degree. Thank you.